Hello, someone requested that I discuss body dysmorphia disorder. So, based off of the DSM, that purple book that I showed you last time, it falls under the OCD spectrum. The reason why it falls under the OCD spectrum is because individuals suffer from recurrent thoughts, right? And these recurrent thoughts are more fears, and these fears and images, they control the individual. So the anxiety over these perceived flaws that they have, it will start impacting their life. So to be considered a diagnosable problem, it has to affect a significant impairment in their life. So their relationships, their occupation. It can't just be, oh, I don't like the way I look, and so now it's bothering me. No. It has to cause some kind of negative impact in your life. And then when they're constantly impacted by it and preoccupied, that's when it becomes something to seek treatment for, and it's diagnosable. Okay? So when these individuals suffer from body dysmorphia disorder, they start to establish rituals to release the fear. The rituals can be any kind of compulsion to release the tension. So that could be anything from skin picking, hair pulling, excessive grooming, and other kind of mental act behaviors like constantly comparing themselves to others. And they start to overlap with other symptoms. So they start to manifest depression, social anxiety, and then eating disorders because they're not happy with the way they look. With body dysmorphia, they have one feature. Well, they have several features, but one of the main ones, when we start to see it with a lot of our males, would be with muscle dysmorphia. So they're not satisfied with the size and the shape of their muscles. So it's either too big or not big enough. So, their calves, biceps, bum, and they're constantly preoccupied with the size and their muscular structure. Now, whenever the distress is caused by weight and the preoccupation with body fat, then that's no longer body dysmorphia. This is more an eating disorder. So with eating disorders, we shift towards anorexia, bulimia, food intake disorders, purging disorders, and restrictive eating disorders, because yes, the focus is on the perceived flaw, on how they look, but it's more about the intake or the lack of intake. It's not just, I don't like the way I look, and now I'm going to do this ritual to calm me down, and it's an OCD spectrum. It's more about, what am I doing to not gain weight or control, how I'm affecting my body. It's in a different section of care, and the treatment looks different. So I can talk more about eating disorders on a different video, but I just wanted to mention that they're two separate things, but they do start to interplay together. That's why they're called comorbid. So if you ever hear that word comorbidity, it means that there's more than one diagnosis together whenever you're dealing with symptoms. So if you do have any questions about what you may hear when it comes to diagnoses, because they're kind of confusing, or who does diagnosis or who does kind of treatments, you guys can ask me that as well. All right, I hope you guys have a great day. Bye.